You've been treating your joint pain for years. New medications, different doctors, physical therapy. And it keeps coming back.
What if the source of that pain was never in your joints at all, Batiri, and your doctors have been looking in completely the wrong place?
In this video, I'm going to show you the 4 gut factors that research links to joint inflammation, and the one root pattern your doctor probably hasn't mentioned.
As a middle-aged Caucasian gastroenterologist with a warm smile, I see patients who have spent years treating joints without any.
Your gut lining is a selective barrier, roughly the size of a tennis court, designed to absorb nutrients while keeping harmful substances out of your bloodstream.
When that barrier becomes compromised, a condition called intestinal permeability to MEP, fragments of bacteria and your immune system recognizes those particles as foreign invaders and launches an inflammatory response. And that inflammation doesn't stay contained to the gut. It travels. Through the bloodstream, inflammatory molecules, called cytokines, reach distant tissues.
Research suggests that adults over 60 with chronic joint pain show measurably higher levels of intestinal permeability markers than those without joint symptoms.
I'm going to walk you through 4 gut factors in order of impact. Most people are dealing with all 4 without knowing it. But here's what most doctors never tell their patients to have, and what you can actually do about it starting this week, once you understand what's driving the cycle. Let me tell you about a patient, Ray. This is an illustrative scenario. Names and details are fictional, based on patterns I see clinically. I'll call her Margaret.
Margaret was 68, a retired teacher from Columbus, Ohio. For 6 years, she had been treated for rheumatoid arthritis. No one had ever ordered a comprehensive gut health assessment. No one had ever asked about her digestive history. We'll come back to Margaret at the end of this video.
Factor number 4, tau, and I want to be clear, this is the least impactful of the 4, but still significant. The medications most people take for joint pain itself.
Non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, the medications you've likely been taking to manage the pain.
Long-term NSAID use increases intestinal permeability. In other words, the medication treating your...
This doesn't mean you stop your medication without talking to your physician. It means the gut-joint connection is a conversation worth having, because the cycle can be addressed. When we address gut barrier function alongside joint inflammation, not instead of inflammation, many patients report a different quality of response. We'll get to the protocol at the end. Factor number 3, HEM, and this one affects the majority of seniors over 60 in the US and UK, often without any obvious digestive symptoms at all.
Ultra-processed foods, the category that now accounts for over 6% of the average American diet, can class of additives called
Emulsifiers like polysorbate 80 and carboxymethylthiochmatos have been shown in research models. When that mucus layer thins, pathogenic bacteria get closer to the epithelial cells. Packaged breads, flavored yogurts, low-fat salad dressings, protein bars, foods marked as healthy. Foods many seniors...
The irony is devastating. The more carefully you've been eating, avoiding fats, choosing low-calorie options, picking packaged heart-healthy products...
Research published in Nature found that 2 common emulsifiers altered gut microbiota composition and promoted intestinal inflammation.
The good news, Bren, and there is real good news, Bren, is that microbiome composition responds to dietary change faster than any other sin. But factor number 3 is contributing to a process that factor number 2 then amplifies hard. And this is where the gut-joint connection... Factor number 2 is the mechanism I want you to understand deeply, because this is the biological bridge that connects what's happening in your gut to what you feel in your knees.
When intestinal permeability is elevated, bacterial fragments called lipopolysaccharides enter the bloodstream. That response produces cytokines, signaling molecules that travel through the circulatory system and promote inflammation wherever they land. Studies in patients with rheumatoid arthritis found that intestinal permeability markers were significantly elevated compared to healthy control.
This is why treating joint inflammation at the joint level without addressing intestinal permeability produces incomplete results. You're managing the fire while leaving the gas on. The question isn't just what's happening in my joints. The more precise question is, what in my gut is producing the signal that my joints are responding to?
A diverse, balanced gut microbiome acts as a regulatory layer, producing short-chain fatty acids. But in most adults over 60, microbiome diversity has declined significantly.
This decline in microbial diversity begins around age 60 and accelerates with each decade. It's not inevitable.
Every course of antibiotics, even one, even years ago, can reduce microbial diversity for months or permanently eliminate.
Chronic stress, the low-grade, persistent kind that most retired adults navigate daily, elevates cortisol, which alters microbiome.
And this brings me to the factor that, in my clinical observation, sits underneath all three of the others. Before I get there now, I want to be clear about something important. Every factor I've described has a corresponding pathway of support. This is not a story of damage without resolution. After factor number 1, I'm going to walk you through the specific steps that research supports for each layer of this system. But first, you need to understand the root pattern. Factor number 1 is what I call the systemic inflammatory loop. Once you see it, you cannot unsee it. It reframes everything your doctors have been treating as separate conditions.
The loop works like this. Compromised gut integrity allows inflammatory triggers into the bloodstream, which activate systemic systems. Those NSAIDs further compromise the gut barrier, which releases more LPS, which triggers more research suggests a substantial proportion of adults over 60 with chronic joint conditions may be caught in some version of this loop, without anyone having ever mapped it for them.
Rheumatology treats the joint. Gastroenterology treats the gut. General practice manages the medications. No one is looking at the entire loop.
This is why understanding gut health as a systemic driver, not just a digestive organ, changes the entire approach.
Your doctors are not negligent. They're working within a system where a 15-minute appointment makes systemic thinking difficult. This is a gap in the system, not in the care.
Butyrate, the short-chain fatty acid produced when gut bacteria ferment specific fibers, has been shown to reinforce intestinal barrier.
When patients understand the loop, truly understand it coughs, their approach to every other intervention shifts.
These are not exotic foods, but they are largely absent from the modern senior diet, replaced by the...
So the loop isn't mysterious once you see it. Gut permeability to systemic inflammation.
Let's name the 4 factors clearly before the protocol. Factor 4, NSAIDs increasing intestinal permeability. And factor 1, the self-reinforcing inflammatory loop tau, in which treating the symptom perpetuates the origin. I told you we'd come back to Margaret. She came to me after 6 years of rheumatology treatment with a question that most patients eventually reach. Why isn't this working?
A comprehensive gut health panel showed elevated intestinal permeability markers, significantly reduced butyrate-producing bacteria. Her CRP, C-reactive protein, a systemic inflammation marker, was 9.4 at intake. Her joint patients. Over 14 weeks, working alongside her rheumatologist, not instead of Tugdas, we focused on the 4 gut factors.
At 14 weeks, her CRP had dropped to 4.1. Flare days reduced from 3 to 4 per week to approximately...
I want to be precise. Addressing gut health appeared to contribute to improvement across multiple markers. Margaret's case is not exceptional. It is representative of a pattern I observe repeatedly, patients whose incomplete. Now, Katem, what can you actually do? I'm going to walk you through 4 specific steps that correspond directly to the 4 factors. Step 1, have an informed conversation with your physician about long-term NSAI use. Ask specifically about alternatives.
This is not about stopping treatment. It is about adding a question that most physicians, in fact, not from negligence. Step 2. Read labels for polysorbate 80 and carboxymethylcellulose, but the 2 emulsifiers with the strongest research. Replacing ultra-processed options with whole food equivalents, even partially, reduces the emulsifier load meaning. Step 3. Introduce fermented foods that have research support for microbiome diversity. Plain kefir, unsweetened kimchi, or sauerkraut. Alongside fermented foods, increase inulin-rich vegetables, garlic, leeks, onion, chicory root.
Step 4, and the most important and the hardest to achieve alone, ask your physician for a comprehensive gut permeability assessment.
Markers like zonulin, serum LPS, and fecal calprotectin can indicate whether intestinal permeability is...
I'm not telling you these steps will eliminate joint pain. I'm telling you they address a layer of the mechanism that most treatment plans currently miss patents. You now have the mechanism, the 4 factors, and 4 corresponding steps. What I want to leave you with is something broader.
Your gut is not a digestive organ with occasional influence on the rest of your body. It is the regulatory center.
The fragmented specialty model means that most patients with chronic conditions are treated one organ at a time. while the root system connecting. You are not here by accident. You asked a question that most patients are discouraged from asking. Is there something my doctors aren't connecting? Your body is not attacking you. It is responding to signals. When the signals change, when the gut barrier, understanding this doesn't just change what you eat or what tests you request. It changes the question you bring to every appointment.
You deserve a 15-minute appointment that treats you as someone who has already done their homework, someone who comes in with data.
Every organ in your body is downstream of your gut. That is not a metaphor, it is the direction of flow.
If you recognize any of the 4 factors I described today, type joints in the comments. It tells me this topic resonates, and it helps me know what to cover next. Each week on this channel, I go through one gut-body connection that clinical visits rarely have time to explain. If today's video added something real, if you have a family member managing chronic joint pain, a spouse, a sibling, a parent, share this video with them. The gut-joint connection is a conversation. In my next video, I'm going to cover something that connects directly to today's topic. The hidden gut bacteria that research links to elevated. Your gut is not just a digestive organ. It is the headquarters of your health wealth, and everything downstream gets cleaner when headquarters is functioning. Treat it like one. I'll keep bringing you the connections that the 15-minute appointment doesn't have time for. Because the science is there, it just needs someone to translate it for the people who need it most. Take care of your gut. Take care of the body that carries you through every single day. And take care of the people in your life who are still searching for the answer no one has given them.